My name is Heather Campbell. I'm an RN in the emergency department, and I'm going to be discussing the implementation of bedside report in the emergency department. My presentation overview is going to be of the description of the problem, which is bedside report importance, bedside report and the effect on patient safety, the significance to nursing, quality of nursing care improved, rationale of change, literature review, bedside implementation proposal. So the description of the problem is, in the emergency department ED, there are many events that can lead to compromises in patient safety. When bedside report is not used, it can increase the frequency of adverse safety events while decreasing patient satisfaction. So bedside reporting is beneficial in that it can make the difference between life and death. So nurse safety check and review during ongoing and oncoming shift is very beneficial. And also patient safety and quality of care improved is very important. We want our patients to feel like they're important and taken care of. So the significance to nursing is, in the emergency department setting, it's very critical, it's very high-paced, it's very busy, so we want everything to flow and to make sure that care is not disrupted for our patients. So also by doing that, we can have nurses accountable. So by us going in the room, we're verifying rates, we're verifying if the patient's safe, we're verifying if they need anything, we're holding each other accountable. Also, we're improving communication by each of us speaking with each other and having that communication and doing report with the patient and doing it at the bedside. We're going over things that might get missed versus being taken care of, and leading to not retaining nurses. And I hate anything more than to walk into the room and find a patient on the floor needing to go to the bathroom or stating they haven't even seen their nurse. So by us doing this final bedside reporting, we're able to answer the patient's questions. We're able to let them know about what's going to happen throughout the day. If any tests are being done, they will be well informed of what's going on. So, nurse and patient adverse outcomes and sentinel events. This is very important in that you don't want to walk in and find your patient on the floor, or you want to make sure they're alert and oriented, make sure you notice any changes in the night shift versus the day shift. And there you can help the family with any questions. You can just answer any questions that they might have. And also it increases the patient satisfaction. The patients love to feel that they're heard. If they're not being cared for or their questions aren't being answered and you don't go in the room and introduce yourself, the patients feel like they're neglected and they will complain. So if you want satisfaction and you want your patient to be satisfied, you need to be able to make sure that you're doing the bedside reporting. You can answer the questions and they'll know exactly what's going on. So the rationale for change is increased patient safety, increased patient satisfaction, increased quality of care, and increased nursing communication. So in doing my literature review, every article that I came upon, which was 8 articles, had very significance to bedside reporting in a positive way. I didn't run across any negatives of my literature review at all. So upon doing my literature review, all the articles had mostly pros to the bedside reporting. And overall reduction to patient complaints were decreased in the articles. Also, reduction in safety events, including the sentinel events, were decreased. And overall improvement in patient satisfaction with the bedside reporting was also found. As well as most of these articles provided documentation that nurses would rather have bedside report, so therefore they can assist if there's any gaps with any tasks that need to be done, or if there's anything that was left over that the night shift needs to attend to before they leave. Also, this information that was found in the articles was very overwhelmingly positive in supporting bedside reporting. There was nothing that was negative in it. It was all positive. Bedside reporting affects the patients as well as the nurses. I didn't find any type of negative responses to anything that was reported in these articles. Any additional articles that were available that needs implementing of the patient satisfaction was available. The articles were overall just discussing how bedside reporting is a positive outcome. So in reviewing the literature, you will find the patient quality of care, patient satisfaction, and patient safety can sufficiently increased with the utilization of bedside report. And this was by Campbell and DeJounte in 2019. That was my whole literature review summary of when I assessed my articles to have the supplement and documentation to actually back up my proposal. So the bedside implementation proposal is, I'm going to do a nurse and handoff communication tool. These are my two recommendations. How I'm going to do this is develop, education, implementation, and evaluation. So utilization of shift report time frame is going to be assessing of how shift change time is used, implementation of new shift change timeline, and then the evaluation of the effectiveness of actually implementing this proposal. So my two recommendations were the nurse and handoff communication tool, which will be a standardized handoff tool that can assist in utilizing the bedside report process and increase efficiency for staff while making patient care a priority. And this will be geared more towards the ED staff, and it'll be a tool that we can use just for our benefit, and it'll help us in report. Also, it'll utilization of the shift report time frame. Using nursing report efficiently will increase patient safety, quality of care, and patient satisfaction without increasing staff productivity costs. So there won't be no overtime. We won't have to stay longer. We'll be able to do it within the acclimated time that we have given to us before shifts. So the suggestions for implementation will be, with the handoff communication tool, we'll have a focus group that meets and develops tools. This will be the USG, which is United Shared Government, with leadership involved. They will help gear towards determining if education needs are for the staff, if they need help understanding, or we need to send out a letter stating that this is how we're going to proceed with doing the bedside reporting. And the plan of implementation, which is exactly how it will be put into place. We'll set a trial date for that, and we'll set implementation date for the tool. So also the utilization of shift report time frame. The implementation will be starting report 5 minutes after the shift begins, using approximately 5 minutes for each patient handoff. So that means if you have 3 patients, you'll be able to have 5 minutes to discuss with the outgoing nurse exactly what's going on with their care as soon as you get there. So that means that sometimes nurses like to chit-chat a little bit when they get there and get coffee, but sometimes linger away from actual doing bedside report. So we need to make sure we're being more active in coming in and getting to the bedside report versus just talking to each other about what's going on in the morning time. And to check the effectiveness of the change, we will have evaluation tools and surveys and feedback from the staff. And we'll need to do that in multiple evaluations, which will be at 4 weeks, 3 months, and 6 months. We need enough time to make sure that the tool is working, get everybody's feedback, make sure everybody's happy, make sure it's going well. We'll get patient surveys back and see if they've liked it, and hopefully that will increase our patient satisfaction scores. Also, the focus groups will meet to determine if any changes are to be needed. So if something didn't work, or if they needed more time, or if things were missed, or if patients were complaining, or staff members stated they didn't have enough time, we'll just need to take that into consideration and see if we need to implement any changes, and that's when we'll do it at that time. So in conclusion, as a role as a healthcare provider is continually to grow in our knowledge and ability to provide the best care possible to each patient we encounter. Often the growth indicates the need for change in our practice, which is true of most situations. In this situation, we can increase nursing communication and satisfaction while providing the highest level of care possible to patients we are entrusted with by merely changing our handoff process. There have been multiple times when an error could have been caught or prevented by increased communication, understanding, and assessment of patients during handoff. We must address possible gaps in patient safety and make changes as needed. And bedside reporting can do just that. And Oxomark, I got this out of the article in 2020. So overall, bedside reporting is important. We need it to be able to give better quality of care to our patients. And implementing this recommendation and change will be beneficial for all involved, as well as nursing, as well as patients, as well as our ongoing nurses, and as well as the families. If they have any questions, you can answer everything at the bedside, and you won't have to walk into a situation that makes you uncomfortable that you find later. Are there any questions that you might have with the proposal? Anybody have any questions they might like to add? Well, thank you for allowing me to come in and give you my presentation on implementation of bedside proposal. Thank you.